Welcome back. It's been a long time coming, and now more than 2 years into the pandemic, the FDA has approved COVID vaccines for kids as young as 6 months.
Yeah, we know you have questions. Dr. Tess Barton with UT Health San Antonio is here to answer them. And as always, we try to separate the fact from the fiction when it comes to COVID and infections and vaccines. And right off the top, Doctor, I want to talk about what you're seeing in your rounds, what you're seeing in your practice. Are we seeing more kids become sick enough that they need to go to the hospital?
Hi, thanks for having me. We definitely are, actually. So we're currently in a surge, even though I know we're all trying to pretend that doesn't happen, and we're pretty tired of it. But yes, so we actually, in the past 2 weeks, have had several kids hospitalized with COVID-related pneumonias, and that's more than what we've had during May, for instance.
Okay, that's something that parents need to know.
Yeah, definitely. Why do you think if we're in the middle of the surge, are we as the media letting this whole thing down by not talking about this?
No, I think it's important for the media to cover all sorts of issues, and I think this is just one of them. And I think a reminder that we are in currently at the beginning of what looks to be a surge. Partly, a lot of the numbers are difficult to track because most people are now doing home testing, and so many people get reported. So we may be having a lot more numbers than what we are aware of, what we can count, but we certainly can count hospitalizations, and those are on the rise.
Okay, you're a pediatric infectious disease doctor. We know that just for the past few days now, kids as young as 6 months old are able to get the Pfizer and the Moderna vaccines. How have your youngest patients reacted to the vaccine?
Well, mostly, kids will react exactly how they react to other vaccines, which is that they hate shots and needles. But I think that parents are mixed. Some parents are really excited and they can't wait to get, that final little piece of the puzzle in their household vaccinated when everyone else has been vaccinated. And other parents are still standing by, wanting to see what happens, or, just keeping their kids under a little bit more of a layer of protection, keeping them more isolated or away from other activities rather than vaccinating them.
If you get your child vaccinated, are there certain things that parents should watch out for?
So the side effects for the vaccine in young children is very similar to what we've seen in the school-age children and the teenagers, which is primarily, a sore arm, not uncommonly to have a fever for a day or two after, and to feel tired with some increased napping and headaches and things like that. And those side effects will go away. Those are common after any vaccine.
Yeah, I guess the concern is that we're talking about kids as young as 6 months old to 2 years old. They can't speak. They can't really explain to you what's happening if they're dealing with side effects. And that might be why parents are concerned.
That's right. And so, kids who are younger sometimes they won't feed as well. They'll sleep more. They'll be grouchy or irritable. And those things should subside within a day or two. And that's the case for most of these kids.
So we know the Pfizer and the Moderna vaccines were approved for kids. They are 2-dose treatments. Is that the same for kids?
So they are, no, for the younger kids, it's a little bit different. For Moderna, which is actually a new opportunity for children, it's a 2-dose series. But for Pfizer, it's actually a 3-dose series for the kids 4 and under.
Obviously, we want to answer as many questions as we can for the people who are watching at home, but obviously, your pediatrician is who you should consult with first before you decide to do this. What are other tips that parents should do to prepare for the shot themselves and maybe prepare their kids for the vaccine?
So I think actually involving the pediatrician is maybe the very most important thing that a parent can do. First of all, because the kids who are in this age category, these 6 month to 4 year kids, are kids who are getting other shots. And so the pediatrician's job is to make a vaccine schedule for each child individually, depending on what vaccines that they need. And so rolling the COVID vaccine into that is important kind of coordination for the pediatrician to do. I also think that that's a really important resource for parents who have questions about safety or, side effects. That's the person that they know and trust to see their kids, and that's who they should be turning to get information about the vaccine.
You just mentioned something that I want to go back to. Babies that are that young, you just mentioned, aren't completely inoculated against things like the MMR virus, hepatitis, and things like that. So I know that you're trying to get parents to go out there and get their kids vaccinated. Can you talk about the risk to kids who, if they're not vaccinated against COVID, and also if they happen to get any of these other viruses that they're not protected against?
Sure. So the risk for COVID is it's a disease that's currently circulating in high amounts, right? Unlike something like the measles, right? So measles vaccine is really important and really effective, but we don't have a lot of measles running around, or polio, but we have a lot of COVID. So the impact of a vaccine on preventing something that's very common is actually pretty important. And so just like you said, these kids are getting other vaccines. And so, we've seen kids some of the kids who come in hospitalized are actually kids who have more than one virus. They come in with the flu and with COVID, or RSV and COVID. And so some of those we have vaccines for, and some of them we don't. But I think as many, if you can prevent your kids from being barraged with viruses all at once, that's generally for the better health of the kid.
Absolutely. And that's what the main reason that you took time out of your busy day today to talk to us is because you want to urge parents to get their kids vaccinated.
I do. I'm a pediatrician, so I'm an infectious disease doctor, but I'm a pediatrician, and pediatricians, our mission is, to save children's lives and to keep them healthy so that they can grow up and be successful in whatever it is that they want to do. And so, vaccines have long been a part of the way that we keep kids healthy. And I think it's exciting that we can now include this into that vaccine schedule for those younger kids.
All right. Dr. Tess Barton with UT Health San Antonio, we appreciate you being with us today.
Thank you for having me.